Hello. Welcome to a brand new community health nursing lesson. My name is Jessie Wheatley and I'll be facilitating this lesson. Please make sure you have your notes in your notebook ready so you can follow along with this lesson. Thank you for listening to this lesson. This lesson covers the RN nursing care for vulnerable populations. I have included the objectives that you must meet by the end of this lesson. They are very comprehensive, they're very detailed. You can meet these objectives by reading the textbook or also by going over the notes. Let us now together go over a quick overview of poverty, homelessness, mental illness, and teen pregnancy as far as how they contribute to vulnerable vulnerable populations. Poverty and homelessness affect the health status of the people. For you to understand poverty and homelessness and mental illness and teen pregnancy, consider what you believe personally and your attitudes about client perceptions of their conditions and the social political factors that influence their situation. There's a lot of people that have preconceived notions about what it means to be poor, what it means to be homeless, and what it means to be mentally ill. I would like for you to approach these clients the same way you would approach a disease process that you may have some preconceived notions about. We usually, as nurses, do not treat what we feel as right by us. We usually treat the problem that exists before us in the most uh, objective manner, utilizing the nursing process. I challenge you to do the same thing with these issues. What is poverty? The definition of poverty varies depending on the source consulted. The federal government defines poverty on the basis of income, family size, age of the household, and members of the children younger than 18. Those are those who are poor. Isn't that poverty has less to do with income, more to do with a lack of family, friends, love, and support. So there's more ways to define poverty than what meets the eye. Factors leading to the growing number of poor people in the United States. We have talked about these before: decrease in earnings, diminishing availability of low cost housing, increases in number of households headed by women. Women only incomes are usually lower than men incomes, inadequate education and lack of marketable jobs. We know welfare reform has affected poverty rates, and reduced Social Security payments to children has also affected poverty rates. We know that poverty has a direct effect on the health and well being across the lifespan of patients. We know poor people are sicker, and we talked about these. We have groups that I want you to pay attention to. In both rural and urban areas, we want to look at the homeless in both rural and urban areas. We want to look at families, single mothers, single women, recently employed persons, substance abusers, adolescent runaways, mentally ill people, and single people as we intervene for people. Here are some of the factors contributing to homelessness, and I want you to be aware of them. I want you to know that there's a lot that goes to why people become homeless. Okay, uh, we also can talk about reproductive health care services for teens and teen pregnancy. And we know that reproductive health care services for teens requires a lot of sensitivity to the special needs of this group, including knowledge of the state laws, confidentiality issues. Services to birth control, pregnancy, abortion, and adoption services are also all matters that there's a lot of sensitivity to. Okay, the thing about it is, though, nursing care should incorporate the pregnant teen and the vulnerabilities that affect that age group. Okay, I have put a few points for you to remember as far as the subgroup, and I want you to pay attention to those and read those. Nurses need to be aware of the impact of substance abuse on health outcomes. Substance abuse is the number one national health problem, linked to numerous forms of morbidity and mortality. Harm reduction is a new approach to these problems, and it deals with substance abuse primarily as a health problem rather than as a criminal problem. All persons that have ideas and opinions and attitudes about drugs that influence their actions. Social conditions such as a fast paced lifestyle, excessive stress, and different things really contribute. In young people, older adults, intravenous drug users, illicit drug users, drug re- addiction is often a family problem. So the nurse needs to be aware of that, that it's not really just about treating the individual. We also need to understand the factor of codependency and in intervening for this population. In thinking about vulnerable populations, the nurse needs to be aware of violence and human abuse factors. This is not a new phenomenon, it's a growing community concern. People in communities across the U.S. are frustrated by increasing levels of violence, and nurses need to be aware of this. Nurses can evaluate and intervene on these factors. I have included in your notes about child abuse and spousal abuse and important things to remember. Remember that child abuse can be physical, emotional, sexual. Incest is a common, particularly destructive form of child abuse. We also know that spousal abuse is very common. Usually it happens to be commonly as wife abuse, but there's also husband abuse that you need to be aware of. And I've included some key points about that nurses need to be aware of that you need to also know for your exam as far as human abuse and child abuse and violence is concerned. Populations that are afflicted by infectious diseases are a huge concern for nurses as well. Well, the burden of infectious diseases is high in both human and economic terms. So, preventing these diseases must be a high priority for the healthcare system and for nurses. I have included some key points regarding infectious diseases and communicable diseases. I've also included some things that you need to be aware of in your notes regarding these infectious diseases. Infectious disease prevention and control. Uh, Everything that we talk about is preventable. Like, I mean, every in this unit we need to be aware of different factors and ways we can control transmission of infectious diseases. I've also included a review of things that you probably had forgotten and you had covered in learning about different infectious diseases. Oops, I'm sorry about that. So, a little bit about HIV testing and things that you need to review for your knowledge regarding infectious diseases. Thank you for listening to this lesson. I hope you have enjoyed this overview of vulnerable populations and vulnerabilities. For questions about this lesson or corresponding notes, please feel free to email me. Have a lovely day.